Communication is the basic building block of all relationships. They could be personal relationships, they could be business relationships, they could be all sorts of things, but it all starts with communication. A lot of people take communication for granted, but there's a lot of people out there as well that need to bring in some people to help them communicate in a variety of different ways. The name of the company we're talking to today is Harmonic Speech Therapy, and our guest is Tallulah Breslin, right here on All In. Tallulah, how are you today? Great to see you.
I'm good. How are you?
I'm doing well, thank you. So is it fair to say that communication is where everything starts, whether it's on a personal level, a business level, et cetera? Am I making that too elementary or not?
No, I think communication is vital.
It's absolutely vital, and unfortunately for some people, they need to bring in some professionals like yourself to help them to be able to communicate for a variety of reasons. You are a speech language pathologist. Now then, that's a big word that this guy's not that familiar with. I've heard it before, but I'll be the first to admit I don't know exactly what that means, Tallulah. So what is a speech language pathologist?
So a long time ago, we were known as speech therapists, but we basically work on all aspects of communication and cognition, voice, anything to help someone be able to think, understand, and communicate better.
Well, I got to ask then, let's back up just a little bit. What made, first of all, that sounds like a great profession, but I'm just curious, when you were deciding which direction to go with your own life, how did you come up with this? How did you decide this is what I want to specialize in?
I worked in home health with a woman who couldn't communicate at all, and she got a communication device that she used with her foot to tell us all sorts of things, like that she was scared of the bus driver, and I was really moved by her experience.
Well, bless you for that. Thank you. Thanks for sharing that with us. I think that's a wonderful thing, and I'm going to get to those devices here in just a little bit. But going down the notes, there's a variety of reasons people need you, one of which is, for example, if someone has Parkinson's disorder, you can work with people with Parkinson's and other ailments to help them. How do you work with someone in Parkinson's to help to increase their communication level?
So Parkinson's makes it so that it's harder to be heard. It's a neurological and motor speech disorder connected to Parkinson's. So basically your voice becomes softer, it's harder to hear, you may not be able to be heard on the phone, you may even feel like you're not there when people don't respond when you talk. And using the LSVT loud method, I teach people how to recalibrate themselves to use a louder voice so that they can continue to participate in the workplace and interpersonal communication and connect with other people.
That's just outstanding. And you were talking about how Parkinson's makes you lose the emphasis of your voice. It gets softer and softer and softer. But other patients and clients that you work with have no voice. They're nonverbal. Autism, for example. You work with autistic folks. How in the heck can you help autistic people be heard?
So I help with something called AAC, or Augmentative and Alternative Communication. We will evaluate someone, and I can try a lot of different kinds of devices, and maybe they're going to use their foot or a keyboard or their eyes, and they're going to access language on a device that will speak for them. Anything from symbols to letters to whole messages. So somebody, for example, who couldn't access their school lessons before with a device can participate in learning just like their peers, or I had one patient who learned to be able to say the jokes that she used to say before she lost her voice with her device. I know one that was particularly meaningful for me was I had a client who did have a voice, but he was so quiet you couldn't hear him. And during COVID lockdown, he wasn't able to have his family visit. So I taught him how to use his device to activate Google Alexa that would then call his wife, and he was able to tell her, "I love you," using his eyes, which I really loved.
Oh my goodness. Yeah, I love that. Thanks for sharing that one with me. I have to grab a tissue here in a sec, but that's just type of the things that you do. But I've got to ask you something, going back to folks who have been nonverbal their entire life. When you get them to the point to where they're able to communicate, I just can't imagine what that must be like, not just for the patient, but for maybe even more importantly, for the family and friends that have been with them their whole life that have never been able to communicate with them. Can you put that, no pun intended, but can you put that into words, how meaningful that is when that day happens?
I mean, I think that communication is a basic human right. We all deserve to find a way to be able to communicate. And when you can't communicate, it's hard to really connect with other people. So to have your child or your loved one gain the ability to communicate is really powerful.
It's hugely powerful. And again, it's not just powerful for them, it's powerful for their loved ones who've always wanted to be able to communicate and they can't. And then because of you and the time and the energy and the expertise that you bring to the table to assist someone, it doesn't just help them, it helps everybody around them. And that there is a beautiful thing, Tallulah. I got to say that. I've got to ask you this, though. I know a lot of times you're working with people with their different voice training for a variety of reasons. I'll get to one more here in a second, but it takes a lot of work. I mean, sometimes their voice is soft and you have to work with them to get it stronger and stronger and stronger. Does it work sometimes to where they can just go the surgical route? And if not, why is what you do better than surgery?
So there are different surgeries. The particular reference in there to surgery was for people who want to change their voice. If you shorten your vocal folds, you can make the pitch go up, but it doesn't change all of the other aspects of communication, and voice and communication are very multifaceted. It's the reason why if you had two children who were assigned different sexes at birth, they would sound very different, even though their bodies are very similar. When you have surgery, you can change a little bit about your pitch, but all the other things you have to learn how to change.
And this is what you were talking about. I skipped over. I was going to get back to it. We'll jump in there now. Gender alignment voice training. That's what you're referencing there. I'm not familiar with. Is that a pretty common thing now, or is that something that has been around that you personally have worked with for a while? Or give me a little background on that. I'm not familiar with this.
In 2014, I had a friend ask me to do gender aligning voice training with her. She was transitioning genders and she wanted her voice to match her identity. Ever since then, I've been able to help different people who wanted to transition, their voice match them. I work on a lot of different aspects of communication. We can work on pitch and resonance, intonation, all the different things that make somebody have their identity match who they are. Even people with autism might think that their pitch is too high, that their rate is too fast, and that their voice doesn't sound as mature as they would like. There's many different ways I can help people with their voices.
How do people find out about you? I mean, I talk to a lot of different businesses on here, if you will, that they go out in a variety of ways, but I'm just trying to think, do you work through medical associations where they refer you, or how do the clients find out that you're out there for them?
So I have a website, I connect with other professionals, and I also provide different support to different places that these people gather and just try to connect with people on the internet and help them find me.
You know, we were talking off the air when we were getting started today that you do a great deal of your business via the miracle of Zoom. Has it always been like that, or is this a COVID-related issue to where you've had to switch things around to where you can't meet people in person like you used to?
So Zoom is entirely related to COVID. Prior to COVID, I worked full-time plus in nursing homes. And with COVID, I transitioned to having a virtual business, and I really love it. It's a way for me to connect with people far wider than I could before, who could be in many different places. And I'm also able to work on a lot of things, whereas when I help people in nursing homes, it tends to be just people who are older and it's a specific thing. And I really like that I've been able to branch out and do some of the other things that I used to do when I was in the schools as well.
See, that's great. Everything old is new again, and you've been able to embrace it. Is it easy for the people on the other end to embrace it as well, or did that take a little work to get them to be able to Zoom to you?
I mean, I think people are really picking up very quickly and just coming to the internet and virtual learning just wonderfully. People are really adjusting.
Well, I'm just speaking for me. I've adjusted, and let's be honest, Tallulah, if it wasn't for Zoom, I wouldn't have got to share your story today. So thank you, Zoom, wherever you are, for hooking up me and Tallulah today. But most importantly, thank you for getting her out there to be able to continue to take care of the people that need to communicate just like the rest of us. Tallulah, it's a great story. Thanks for sharing it with us. Keep doing what you're doing, and thank you for it.
Thank you for having me.